You should now be seeing the PowerPoint on your screen. So I'll turn it over to Kevin for housekeeping.
Good morning, everybody, and welcome to our session today at Envision New Mexico. I wanted to let you know that we are recording the session, so please don't include any confidential patient health information while we're talking today. On screen now is information on how to connect audio. If you're unable to use your computer mic and speakers, you can use this through your phone. Just don't place us on hold. Mute is *6 if you need that. Unmute is also *6. I can mute you if I need to, if I hear feedback. If you do use this option, please mute your computer mic and speakers. And we'd love to see you on camera. We do have the cameras enabled, so click on the little old school camera icon there, and when you're done previewing, click Start My Webcam. Our disclosure and accreditation statements are on screen right now, and we don't have anything to disclose. We do offer case consultation reimbursements. Molina and Blue Cross Blue Shield New Mexico actually does that. They're partnered with us. We don't do that for this series, but for our other sessions. So if you're interested in that, the reimbursement is fairly significant. So please get in touch with us for that for our open mic series at this point. And that's probably it for this year, actually. And now's your opportunity for roll call. We already have Katie Avery is on with us today, and it looks like we might have somebody else on audio only. If you wouldn't mind unmuting, *6 will do that for you, and let us know who you are and where you're from. And anyone else who has joined us, it's roll call time. We're ready to hear your voice and where you're from.
This is Doreen Campbell from the Powhatan Student-Based Health Center, and I was on the phone one, but I think now I'm able to get onto the computer one, so that's for who this is.
Doreen, hi, this is Kevin, and welcome. And I just wanted to let you know, it looks like your audio is going through the phone, which I can kind of see from here, which is perfectly great. And I hope you're able to see the screen and Caitlin there on screen.
Yes, I can.
Excellent. No feedback or anything. I think we're in good shape. And I'll turn it back over to Caitlin.
Great. Thanks, Kevin. Welcome, everyone. So this webinar is part of our grad series webinar. It is supported by the Public Education Department through the Pregnancy Assistance Fund grant with the Office of Adolescent Health through the U.S. Department of Health and Human Services. We do want to note that this content is solely the responsibility of us as the presenters and does not necessarily represent the official view of OAH or the Public Education Department. So we're glad you could join us for this series, and it is the last one of two that we have scheduled. One is this one today, and then we have one next week as well for wrapping up this series. So today we'll be talking about school-based health centers and expectant and parenting teens. What care can be provided? Best practices for school-based health center providers. And I'm Caitlin Adams. I am a quality improvement coach and health education consultant here at Envision New Mexico. And I work with school-based health centers across the state. And I also work with the Grads Plus initiative to support school-based health centers in the work that they're doing around caring for expectant and parenting teens. So as I mentioned, this is going to be a part one of two series, and it's intended to provide you with some specific areas and tools that you can work with your expectant and parenting teens around. And we're really kind of gearing this more towards best practices for providers. And then the New Mexico Alliance for School-Based Healthcare will be presenting next week, and their presentation will be geared more towards support persons working with teen parents and teachers, and they'll kind of provide a larger scope and kind of limitations within the school-based health center for providing care to help others understand how they're making kind of referrals. But again, I'll be focusing more on the best practices. And our best practices were developed as part of our grads work to really support the school-based health centers, and we have developed a guide of which this webinar is based from. And the guide will soon be released broadly to school-based health centers and will live on our Envision New Mexico website. And again, it's really a guide, and we present some practices that are research-based, although I want to note that they aren't protocol, it's really just some best practices. And each school-based health center can vary in what they provide to expectant and parenting teams. I'd also like to mention that many of the best practices presented today are unique to expectant and parenting teams, but also there are many that overlap with working with all adolescents. And so just keep that in mind as we go through this today. And on that note as well, we have a lot of information to cover today, so I'll be kind of providing the overview of best practices, though we have a lot of supportive webinars. If you wanted to know more details about some specific topics, we have a lot that are recorded on our Envision New Mexico website, and you can always reference those if you're interested in a particular area and want to go into more depth about it. So first, I'd like to set the context for supporting expectant and parenting teens. And while data does show that there are disparities among adolescent parents as compared to their peers, we want to acknowledge that the data does show that teen girls who have babies are less likely to finish high school, more likely to rely on public assistance, more likely to experience poverty as adults, and more likely to have children who have poor educational, behavioral, and health outcomes over the course of their lives. But we do want to also provide the information that evidence does not support the use of shame or stigma to discourage teen parenthood as effective. And so even though we acknowledge some of these disparities, as providers, we can still come from a frame of resilience and support teen parents, as it is not a universally negative experience. And school-based health centers are really well positioned to support academic and health outcomes for expectant and parenting teens, both mothers and fathers, as they're located on a school campus, and therefore they are removing the barrier to access for those teens. And so we want to ensure that the care they're receiving at the school-based health center is comprehensive and dignified. So here's a slide to show some of the areas to support expectant and parenting teen families. And again, some of these overlap with what you're already doing in the school-based health center. So sexual and reproductive health care, prenatal care, postpartum care, well child care for the children of teen parents, generally infants and toddlers, and then well child care for adolescents. So again, there may be some specific areas within that you can be supportive of teen parents, even though some of these may overlap with the other students you're seeing. And so as we look at all of these different areas, really it's important that we recognize these as areas in which we can be supporting the health literacy of expectant and parenting teens. So really building the health literacy is important for parents as they strive to be advocates for their own health and for their child's health, and learn to navigate health systems so that they can be effective as parents. So just keep this in mind as we go through some of these areas, as the overall goal is to really support the health literacy, especially for these young parents. And I will also mention that there is a health literacy guide specific to supporting expectant and parenting teens as part of this Grads Plus work that the New Mexico Alliance for School-Based Healthcare has developed. And I'll show you their website later, but it is accessible there. So that's kind of a supportive tool and document that you can use. So, and we'll be talking about some tools throughout the webinar, and they'll be noted by a little tool icon. And so that is definitely one tool that you can turn to, is that health literacy guide. So the basic expectations of a school-based health center that are funded by the New Mexico Department of Health, which is the majority of funding source for school-based health centers in New Mexico. The primary care standards include, from their standards and benchmarks in 2015, that a system for triage is in place based on student acuity, and no student is turned away based on a pre-existing condition, including pregnancy. At minimum, the provider should assess and refer. So that's just the general expectation for school-based health centers who are Department of Health funded. So the first area we'll go into is sexual health, and as I mentioned, this is something that applies to all adolescents. But this is the sexual health history tool, and I think it's a really great tool that comes from the CDC Adolescent Health Working Group. And we do actually have a full webinar on just this topic, so I won't go into it into depth, but it does help to identify risk of STDs and provides an opportunity to really open a conversation with your patients about making healthy decisions. And this can be kind of an opportunity, especially with expectant and parenting teens, to talk more about pregnancy history and plans, and also their general sexual practices as it may relate to their current pregnancy or for fathers. So it really is kind of a tool to be used as a door opener. And so the 5 P's of the sexual health history are partners, practices, protection from STIs, past STIs, pregnancy history, and plans. So there is a full guide that goes with this, if you search for this 5 P's of sexual health, the CDC has a published guide and you can read more about that. But again, this is something that could be done during an initial visit, routine preventive exams, or if any STD symptoms or services are being requested by the school-based health center, and both for males and females. So again, that's kind of the door opener, and as part of that, we want to recognize that the confidentiality laws in New Mexico allow for minors of any age to access sexual health care services in a confidential manner, and school-based health centers can do that and can provide that care confidentially. So that's an important piece of serving expectant and parenting teens, is being familiar with those laws. And if you're already in a school-based health center setting, you probably are very familiar with them. And also, as part of our best practices in sexual and reproductive health care is the recommendations on contraceptive counseling from the American Academy of Pediatrics. And they really highlight the use of a tiered counseling approach to review all contraceptive methods. So if a student is coming in for early on, maybe in their pregnancy, this is something that you could actually be talking about future pregnancy plans as part of their sexual health history, and talk about contraceptive methods. And using the tiered counseling approach, you would be starting with your long-acting reversible contraceptive or LARC methods first, which are your IUDs or implant. Talking about them first because they're the most effective forms, and then going through to the least effective forms of birth control. And so it's also important to note that LARC methods are first-line contraceptive choices, as established by the American Academy of Pediatrics and and ACOG. So they both endorse LARC methods for adolescents. And this, again, is a conversation you could be broaching for either a new parent or a student who's pregnant and is thinking about future planning for their family. And also, as part of best practices with adolescents, using models, visual aids can be very helpful, and also addressing common concerns about various methods, side effects, and myths. And we also want to encourage the involvement of males in the process for selecting birth control, and kind of depending on the relationship maybe between the female and male, that could be something to address. So particularly related to our teen parents are delaying second pregnancies or repeat births. So a repeat teen birth is a second or more pregnancy resulting in a live birth before age 20. And in New Mexico, 17% of births to women under the age of 20 are repeat births. And so this is a particular area where you could be working with students around family planning and initiating your contraceptive counseling during pregnancy, especially talking about your LARC methods. And so advising women to space their babies at least 2 years apart can be helpful for the child's health and mother's health as well. And so that's some of the best practice recommendations that we've included within our guide. And so having that conversation could be something you're doing as a medical provider or even as a behavioral health provider. And counseling could focus around educational and career goals and providing motivations for delaying second pregnancies. And so I really encourage the use of motivational interviewing as an approach to this kind of counseling. We have a lot of different motivational interviewing webinars and series that we've done. So this is definitely an area where you could utilize those skills for family planning counseling with your current teen parents. Also important in delaying second pregnancies is connecting them with support services that can help delay the second pregnancy, such as home visiting. And again, kind of getting the father on board if they're in a relationship that's agreeable, having them as well connected to some services may be also important. And we'll review more of those as we go through the webinar. And as I mentioned, LARC is really the first line form of contraception that's recommended, and you can refer to the CDC U.S. medical eligibility criteria for contraceptive use for your young people who have just had a baby. So for the postpartum period, there are recommendations from the CDC that can be referred to if that's something you're exploring with your teens. So also on the topic of sexual health is sexually transmitted infections. And so as part of the sexual health history, if you're finding out about the various behaviors and possible risks, we did include sexually transmitted infections as part of the comprehensive care that you could be providing to expectant and parenting teens. And so the CDC guidelines are briefly listed up here. They are more in-depth, of course, if you wanted to reference those CDC treatment guidelines. They came out in 2015. So annual gonorrhea and chlamydia screening should be done for all sexually active adolescents annually, or if they come in and they're symptomatic. And pregnant adolescent females should be screened for gonorrhea, chlamydia, HIV, syphilis, hepatitis C, and that's if hepatitis C specifically if they're at risk. And I just want to mention too that a lot of this could be done by their prenatal care providers, so it may not necessarily be something that the school-based health center is doing, but it's something to keep on the radar if your student is coming in either with symptoms or they haven't had that screening done. It should be done for all pregnant adolescent females. And routine HIV screening is also important for all persons aged 13 to 64, pregnant females, or those seeking evaluation of treatment of STDs. So all of the full guidelines have been included in our guide, but I included just kind of the overview here as important to keep on the forefront of part of the care that can be provided to expectant and parenting teens. And so another piece of sexual health care that school-based health centers may be providing is pregnancy testing. And so we have included pregnancy options counseling as and some best practices for that within the guide. And so I've listed some of that here. And so I'll go over some of the best practices, and these are recommended by the Physicians for Reproductive Health. And I'll reference them at the end so you can find out more if you'd like. So as part of pregnancy options counseling, when a student comes in to take a pregnancy test, and that's something your school-based health center may be doing, it's important to inquire and be open, be a listener, and don't make assumptions. Providers should be able to discuss all of the pregnancy options without interjecting their personal bias, and if that's not possible, then they should refer to another provider for non-directive, unbiased options counseling within a timely manner. And pre-testing counseling can be an important part of this. So when the student comes in and they ask for a test, pre-testing counseling can be done to ask questions such as, what are you hoping the results will be? Do you know your options if the test is positive? And have you thought about what you might do if the test is positive? So these can be really important before that actual result comes through. So when disclosing a positive result, it's important to normalize experiences For example, lots of people have asked me that question. Validate feelings. You're doing a good job, or it's okay to cry here. Seek understanding. How are you doing with this information? Tell me more about that. Reassure the patient. I will support you no matter what you decide. You don't have to decide today. And this kind of counseling can also be an opportunity for referring to your behavioral health provider, and a behavioral health provider can help be a support person to kind of weigh out their options. And so if a warm handoff is possible, that's a great opportunity, or at least letting the patient know, we have our behavioral health person here, and they're here on such and such day, and we can connect you with them. Again, you have time if you want to think about this. You don't have to decide today. They can talk to you more about this. I know that also parents are very important in this decision for a lot of young people, and whether that's good or bad, providers can be the person to help facilitate that conversation with the parent, or help the patient. Or help the patient to practice sharing this information with their parent if that's something that they want to do. And when we talk about referring for the various options, whether it's abortion, adoption, or if they plan to parent, it's important to know your referral sources. So let's say you're referring out to an adoption agency or support system. It's really important, again, that you are familiar with what those referral sources are, and that you're referring to a place where the patient can feel like they're welcomed, that they're youth-friendly, that they are getting reliable information. So I encourage you to if you don't already know the sources in your community for whether it's, again, adoption, abortion, or parenting resources, that's kind of a take-home message, is get to know those referral sources. And so for students wishing to continue pregnancy, if you have a GRADS program at your site, this is an opportunity to refer to your GRADS program. And so GRADS is at 25 schools across New Mexico, and again, this is part of the GRAD series that we're doing, so we really want to highlight them as a really effective program for supporting teen parents. And the New Mexico Alliance for School-Based Health has some referral forms for school-based health centers to use with students, and a provider can fill it out and say, this is a program that's here at our school and I'd like to refer you, or vice versa. If a GRADS program identifies somebody that has a need for services at the school-based health center, there's forms for GRADS programs to use through the, again, that you can download. So I definitely want to highlight those if you do have a GRADS program. If you don't have a GRADS program, there are some case management services available to expectant and parenting teens if they don't have an actual program at your school. So I have their website listed later in the presentation if you'd like to refer to their website, and you can always refer your expectant or parenting teen for some limited types of services to support them. And the other thing I would just highlight too is that this is really a critical point, and having a solid process in place at your school-based health center for that next step is really crucial. So if you don't already have a solid process for what you do when a student is identified as pregnant at that time, I encourage you all to work with your team again, and work with your community resources so that you're referring appropriately, and that student is in good hands from the moment that they come in for that pregnancy test, and there's a solid process for them after. So at that point, we'll kind of talk about now going forward for students who are carrying their pregnancy and are pregnant parenting. So this is an American Academy of Pediatrics statement on caring for teenage parents and their children, and so it really highlights the different things you can be doing, which is especially important The first one at the top, providing a medical home for teen parents. So school-based health centers aren't necessarily in a position to be the medical home, but we'll talk about this in a minute, and it's really important for school-based health centers to help a student establish a medical home if they don't have one already. Addressing development of both infant and adolescent parents. Again, this is a huge piece in supporting the health literacy of the adolescent. Encouraging continuation of healthful behaviors from pregnancy, assessing for risk of domestic violence, and we'll talk about that also, including both parents or caregivers in patient education, and of course if this is possible and agreed upon between the male and female partners. Utilizing community resources, emphasizing the importance of completing high school, and praising achievements in healthful behaviors. So these are just some general guidelines and kind of help point to the care that could be provided. So more specifically, as I mentioned, ensuring the student is connected to a medical home. This is really important for our expectant mothers, so helping them connect to a prenatal home. It's possible that if you do have a grads program that they're already working on establishing a prenatal home for that patient if they have case management through grads, but this is a really key piece, and so as a provider at the school-based health center you can help to do that. Acute care visits are opportunities for supporting expectant mothers, and this kind of goes back to what we talked about earlier, is that a student shouldn't be turned away based on their condition of being pregnant. So if they come in with some acute care need, it's an opportunity to at least assess and refer at minimum. But pregnant moms will have some particular needs around symptom management. So if a student comes in with things such as nausea, headache, back pain, constipation, maybe they're experiencing fatigue or not sleeping, those are all things that the school-based health center can help to manage and come up with a plan to help them get through their day-to-day work at school. So anything that doesn't need immediate intervention from the obstetrician or other provider are all things that the school-based health center can do. So, and that may also be any other kind of illness, such as like an upper respiratory infection or sinus infection, or minor injury that's unrelated to childbirth. School-based health centers can also do blood pressure readings, weight checks, urine tests, etc. So those are some just general guidelines. And again, it's anything that wouldn't necessarily have any significant impact on the pregnancy. Anything such as a high blood pressure, a severe fever, severe bleeding, abdominal injury, etc., of course, should be taken more seriously and taken on by somebody else and referred out. So again, the role is more around the daily management, and it's really important to be thinking about if a student is in school, how can we help them to function better and get what they need so that they can get through their day. There's also opportunity to screen for substance use, depression, anxiety, intimate partner violence, and reproductive coercion. So if you're seeing an expectant mother, those are some tools that you can use for screening. And most of the school-based health centers already have some depression, anxiety screening and assessment tools they're using. And we'll review those later. And also substance abuse, that's something that's pretty standard for school-based health centers. So again, opportunities for the school-based health center to dive a little bit more into that with our expectant mothers. Additional care for expectant mothers can include immunizations to support maternal child health, breastfeeding. Again, that's a conversation that can begin early on during pregnancy. Oral health is critical to maternal and child health. Nutrition and physical activity. And I'd really like to highlight this. I was talking to a couple of providers recently who work in a school-based setting and have seen expectant mothers recently, and they noted that it hadn't occurred to them that coming up with some specific guidance for PE class is really important, as the student had come in and was doing a lot of abdominal crunches in PE class, and that probably wasn't the best idea at her point in the pregnancy. And so tailoring your guidance for participation in sports or PE class is really important. And that may mean that you have to let that student know or give the student some kind of medical exception if there are some limitations for their PE class or sports. Also, helping the student to know and make healthy food choices that are within the school cafeteria. And often we know that that may be limited in terms of choices, so helping them come up with a plan for what kinds of things would be healthy to ensure they're getting their nutritional needs met through the school cafeteria options. Assessment or review of medications, including supplements or vitamins, is also important, and you may recommend a prenatal vitamin if you're waiting for this patient to be referred to a prenatal home. And then, of course, assessing what current supports this patient has in place, including familial and social supports. But in addition to that, some services such as public benefits, health coverage, prenatal or birthing classes, home visiting, child care, the MCO care coordination. And that is, the care coordination is something that all expectant teens do have access to, so you may help to initiate that kind of conversation with their MCO if need be. And I know there's a lot of work going on to kind of streamline that and so be more supportive of teen parents through a lot of the efforts that we're working on. Childcare is especially important for expectant mothers to be thinking about early on. We've heard a lot that childcare facilities, Head Start programs have wait lists, and often if they wait until the child is already born to get in for childcare, they're not going to be able to put their child in right away. So having those conversations about what their plans are for childcare early on can be really helpful and help make sure that things are in place for when the baby is born. And then health coverage, I would just say that's another crucial one. They may, again, be getting some of this information or support to connect them with these services through GRADS programs or through their primary prenatal provider, but having the opportunity to talk with your students about it really reinforces maybe what's already being done if they're receiving this information elsewhere. And I want to highlight that referring and coordinating with a prenatal provider is crucial. So any kind of care that you are providing that's relevant for this expectant mother in the school-based health center should be coordinated with the prenatal provider, or that prenatal provider should at least be notified. And anything beyond the scope of the school-based health center should be referred out. So there's little research done on expectant teen fathers, but we do know that early involvement of fathers strengthens the bond with child and contributes to child outcomes. And actively involving the fathers in prenatal related conversations when possible and agreed upon is also very important. As providers, we can assist males in communicating about sexual and reproductive health, again, engaging them in that conversation around family planning for future pregnancies is important. And also supporting men to examine and break down negative stereotypes surrounding fatherhood. Fatherhood can be just as much of a exciting and also scary time for fathers, and helping them kind of work through that is important. I think behavioral health providers have a real opportunity to do some of that work around kind of breaking down negative stereotypes and building up their strengths and resilience as soon-to-be fathers. And of course, praising healthy behaviors and self-care is important for expectant fathers. And also along the same lines as caring for your expectant mothers is screening for substance use, depression, anxiety, and intimate partner violence. So we'll review those tools shortly. Refer to school and community resources. So thinking about particular needs of fathers, maybe support groups or mentoring programs. The GRADS program does have a fatherhood initiative that's associated with most of their sites. So there is a lot of fatherhood programming available for GRADS sites. But again, look to your community and find out maybe what would be available and specific to expectant fathers. Prenatal or birthing classes with a partner, job and life skills training, and this is really important, and I know has been a huge recommendation in terms of where we're hoping to see maybe the state take more efforts in terms of some of the job opportunities and training for teens. And so I know that the Department of Workforce Solutions is developing kind of a teen centered portion of their website. So that's something to look forward to. I just found out about that today. But this can be critical, especially for fathers who are seeking some career opportunities. Also, referring or supporting expectant fathers to enroll in any kind of public benefits that they may be eligible for. So postpartum care, so after baby is born, school-based health centers can be supportive in encouraging home literacy. One of the things I know one of our school-based health centers does is having books available for families, so children's books. If there's a way that you can get children's books within your clinic, if you're seeing a number of expectant or parenting teens, having just a book that you can give them during a visit is really wonderful. And talking about home literacy. Again, encouraging an early involvement of fathers, especially during that first year's period of time once baby is born. And then continuing to screen for substance use, and then particularly postpartum depression. Adolescent mothers are at even greater risk than adults for postpartum depression. So this can be part of your scope of care for a new mother. And also continuing your screening for intimate partner violence and reproductive coercion, and again, referring for community resources. So also as part of the postpartum period, breastfeeding is really a crucial piece and can be challenging for teens, especially that are going to school and having to work around a lot of barriers to breastfeeding. So AAP recommends exclusive breastfeeding for about 6 months, followed by continued breastfeeding as complementary foods are introduced, and continuation for 1 year or as long as mutually desired by a mother and infant. So that's the general recommendation, and school-based health centers, again, can be supportive in that if the mother is choosing to breastfeed. So as providers, you can give information including the benefits and myths, how to manage breastfeeding, including practical guidance, tips for discreetly breastfeeding in public, and I just want to note here that there's very little out there in terms of youth-friendly materials on breastfeeding. And so this may be something that you have to work a little bit out to either find or tailor to your own students. But again, this is conversation that can even happen prior to postpartum, and helping the student to plan this out during their pregnancy, and then being able to follow up with them during the postpartum period would be great. So provide praise and encouragement and address any concerns like potential impact on their relationships, potential impact on daily activities or how to leave their baby. Encourage support from and provide information to the teen's partner as well. So again, involving the father as much as possible in what to expect around breastfeeding and how they can be supportive of that process. And discuss options and strategy for breastfeeding in school. And this is really crucial, I think, for school-based health centers. If school-based health centers are able to provide a private space for breastfeeding, I think that is the best practice, or helping that student to navigate within their own school to find a safe space is really, really important. So the next kind of big area to include as part of the care is caring for the children of the teen parents. So the main piece, if nothing else, if your school-based health center can't see the children of teen parents at the school-based health center directly, at least help to assess the status of a medical home and provide support to locate one. So a family practice may be an ideal option for a teen parent so that the whole family can be seen there. And if you don't already have, if you do potentially have the opportunity to bring in children of teen parents, I think there's definitely some other things you can do, including well visits, following the AAP Bright Futures periodicity schedule, developmental screening, which should be done at 9 months, 18 months, and 24 or 30 months. And if you're doing developmental screening, a standardized screening tool should be used. And I listed some examples there, including the SWIC, the ASQ3, and the MChat. So those are all standardized, and I included the information on the SWIC because that is a non-proprietary, free for use tool. And so that may be an option for your school-based health center if you are seeing children 0 to 5. Whereas the ASQ and MChat and other screening tools that are out there, there's a lot of them. You do have to pay for their use or pay for copies and that kind of thing. So the SWIC is one that's open to anyone. If you're under say an FQHC or other kind of medical sponsoring entity, your entity may already be using a particular standardized tool at their other clinics. So I encourage you to find out what that might be. And then even if you're not able to do any of the well care visits or developmental screening at the school-based health center, encouraging parents to make sure they're following the well care visits at the recommended ages, and encouraging the developmental screening is really crucial. And you can also encourage the parents to track their own child's development, and there's a great tool that we'll mention at the very end for tracking child development that parents can use. Immunizations, that's another thing. If you do shots with vaccinations within your clinic, if you're able to offer them to children 0 to 5, you can follow the CDC immunization schedule and offer them there, or at least encourage your parents to make sure that that the children are following the schedule, and helping the parents to understand what vaccines might be required for their child to enter child care or school. And some school-based health centers are already seeing students or young children for acute care visits due to instances of minor illness. Especially if you have a child care center on site, this is a really great opportunity. You can be that person who's right there to at least triage the child and maybe have a next step for that parent to pursue, even if you're not the medical home. School-based health centers can help, again, reduce absenteeism by seeing those children at the school-based health center, especially if you have a child care center on site. And again, referring to community resources and communicating with the primary care provider, or providing notification of any care that you're providing to that child within the school-based health center setting. So some other school-based health center best practices is we know that the school-based health centers aren't open necessarily year-round or have limited hours. So helping the student who maybe is seeing you regularly during their prenatal period to make sure that they have a plan for summer or for school breaks when the school-based health center is not open. And also encouraging students to utilize the school nurse during school days when the school-based health center is closed. That's a great, collaboration that school-based health centers and school nurses already have oftentimes. So making sure your students actually know that they're both resources for them. Working with the MCO care coordinator, again, these are available to expectant and parenting teens, and they can really support kind of the coordination and management of their care. And also, I just want to note, be cognizant of HIPAA, FERPA. So even if, say, a teacher or somebody from the school is referring to the school-based health center for a particular student who's expectant or parenting, the school-based health center is still bound to HIPAA rules, and therefore they can't necessarily disclose anything to that teacher or other school personnel about the care that's being provided. So that still has to be maintained, and I think FERPA has, again, they have their own guidelines, but at the school-based health center, we need to make sure that we're still abiding by that HIPAA, even when there are other people from the school that are involved in this patient's care. So, and of course, follow up. I encourage school-based health center providers to always, be checking in and helping the student identify needs that are coming up, and really supporting their overall academic outcomes and hopefully supportive graduation. So I want to review some of the tools. So these were kind of mentioned throughout the webinar. So the sexual health history, the 5 Ps, is available there at that website. In terms of birth control counseling, if you're doing that with one of your patients, there's a wonderful tool on the bedsider.org website for patients. They can access it on their mobile phone, or if you have an iPad in the clinic and you're able to use that, they can go through and look at each birth control method, and it also does it by order of effectiveness. So again, it goes back to that tiered counseling approach, and it's a great interactive tool for your patients. Depression, there's a depression screening tool already embedded as part of your student health questionnaire at school-based health centers, the PHQ-2, and then also the PHQ-9 modified for teens, the assessment if they are positive on the PHQ-2. So that's, of course, recommended for assessing depression. And then the SCARED tool is recommended for anxiety, which again is part of your, if you have the iPad, with the student health questionnaire at your site, you may already have the SCARED on there. Otherwise, there is a paper version available, and the same is true for the PHQ-2 and PHQ-9. Those are available if you just search for them online. For substance abuse screening, we recommend the CRAFT. Again, that's already part of your student health questionnaire screening. And the CHISPA, if you're using the CHISPA, that's a great assessment tool for further going into your substance abuse assessment. And then for postpartum depression, we recommend the Edinburgh Postnatal Depression Scale, and you can find that online as well. And then for intimate partner violence screening, I've listed the Futures Without Violence website, and they have a wonderful toolkit that includes a variety of screening tools specific for providers to use. And then also reproductive coercion, that's from the National Coalition Against Domestic Violence, and they have assessment and intervention tools for providers around reproductive coercion. And this really, the reproductive coercion piece may be especially important when that student is identified as pregnant or is seeking services for birth control. So those are all things, those might be timely visits to include reproductive coercion screening. And I want to let you all know too that we do have, again, we have a lot of webinars specific to a lot of these different areas, including sexual health history, birth control counseling, depression, substance abuse, and reproductive coercion. So if you want to know more about how to use those tools and care related to those topic areas, you can find them on the Envision New Mexico website under our videos tab in the archive. Specific tools for working with young children of teen parents include the CDC Learn the Signs Act Early. This is an excellent campaign that includes tracking tools for parents. There's educational components as well for parents so that they can learn about proper development and track their child's development. So I encourage you to look up those if you're going to be seeing the young children, and encouraging young parents to use those tools. Also, the SWIC, as I mentioned before, is a standardized developmental assessment tool, and it's the survey of well-being of young children, and that's available at theswic.org, and you can download the form there, and that's, again, free for use. And then additionally, the required immunizations for school or child care entry are listed at the CDC website, and this can, again, is a really great health literacy opportunity for your young parents that are seeking child care for their little ones. So just some great tools that you can tap into if you're caring for the young children or even advising the parents. So specific resources in New Mexico, the CYFD just put together their new campaign and website that includes specific New Mexico resources. There's a comprehensive list of child care options listed by county. There's parent tips. It's huge. It's quite comprehensive, and so I encourage you to check that out. And I also just found out that GRADS is working with the Pull Together campaign to try and get a teen parent tab that has specific teen parent resources. So hopefully that comes together soon, but even still, there's some wonderful resources on there, and also home visiting. That's another one. You can find home visiting programs listed by county there. Share New Mexico is another resource directory, and you can locate just about anything that's available within your city or county. So I encourage you to look at that if you aren't familiar with it already. New Mexico Grads is listed there, and again, they have, if you already have a grads program, you're probably familiar, but if not, and you need to seek some services to support your expectant or parenting teen, you can look at their website or contact them. And then the New Mexico Alliance for School-Based Healthcare has specific tools and resources under their grads tab on their website, so you can find referral forms. You'll find a variety of issue briefs that list, that kind of talk about specific school-based health center, things that they can be doing for supporting expectant parenting teens. So, and again, they'll be having a webinar next week on this topic. And then some national resources. There's a ton out there related to supporting young fathers, young males. So I included the ones that I think were the most relevant and helpful. So I've listed them there. And then also the Healthy Teen Network has some really great pregnant parenting teen resources. And then I have a variety of references here, and I just want to specifically highlight on this last page the Physicians for Reproductive Health Adolescent Reproductive and Sexual Health Education Program has an in-depth curriculum related to adolescent health, and they have a variety of topics related to this area. And so a lot of the content and recommendations come from those specifically. So at this time, I'll go ahead and leave it open for any questions. You can either use the chat box or chime in via your phone or mic. All right. Well, thank you for joining us today, and we hope to see you back on next week if you're interested in the part 2 of the series. Take care.